Easy. You can see the cells, especially cells, and these cells are there here inside this area. Okay, and these cells are the hair cells. Can you see that? These dark cells. Okay, and these dark cells are giving long hair, but these long hair are present in an area, a conical area, which is connected from above downwards. Really, you can see a connection, and this is a jelly-like area. So it means these hair are going into the jelly. So this area, here you will have the fluid. Which fluid is present on either sides? Endolymph is present. Okay. This area is the whole area is your receptor organ or the sense organ, the complete area. Here you have the supporting cells, you have the hair cells which are the sensory cells, and you have the hair which are coming. One hair is definitely longer than the other and they are connected, and these hair are projecting into the jelly. Okay? So if the jelly is moving, if the endolymph is moving, the jelly will move. If the jelly will move, the hair will also be displaced. If the hair are displaced, then definitely there will be opening of the channels. If the channels are opening, then the ions which are there in the fluid, which ions? Same potassium ions will go inside, and the rest of the story is same, causing the action potential inside that. Alright? So this is structure. Look at that. This is structure, the conical structure in which supporting cells and the hair cells are present. This structure is module in the ampulla. Yes or no?
Yes.
And it is a crest-like structure. Crest means elevation.
Yes.
You call it crista ampullaris. What do you call it? Crista? It's meaningful. The name is giving you the meaning. It's crista ampullaris. It's a cone-like or a raised structure in which your cells are present, hair cells, and the supporting cells are present together. That is your sense organ which is formed. Above that, there is a jelly-like structure on top of the crista ampullaris, and this is present throughout really here, from the roof to the bottom really it is present, and that structure is called the cupula. Okay, you call it cupula. It's a jelly-like structure on top of it. So you have a raised structure in which your receptors are present, and you have a specialized structure which is cupula. Is it alright? And jelly-like structure is movable from side to side by the flow of the endolymph. If the endolymph is flowing, the structure will move. If the structure will move, mechanically the hair cells or the hair will have a move. Okay? So these three organs are present in the ampullae because there are three ampullae. So there are three crista ampullaris. Alright? Now, this is another diagram. Can you see the same thing in the diagram? Crista ampullaris, here this part, and this is cupula. Alright? And you can see the cupula is moving. When the fluid is moving or pushing, it is becoming bent, isn't it? Like this. It can become like this or it can become like this, because if the fluid is moving from side to side, it will cause the movement of that jelly. Okay? So the jelly will change the shape, and you will see. Alright. One more thing. Let's talk about the sense organs of the utricle and saccule also, and let us see if their picture is also there. Now look. Look at this diagram. Now, utricle is like a small room, a rounded room actually. And on the floor of the utricle, if this is the utricle, and we are in the utricle, then utricle has a floor, okay? And on that floor, there is a special piece, like a square, or it's roughly square piece is there, or a rectangular piece is there, and that piece is thick really, and it is lying on the floor, like this, okay? A piece is there, and that piece is the sense organ there, okay? And that sense organ is called macula. What do you call it? Macula. Macula is dot-like or a small area which is there. So on the floor of the utricle, there is a special sense organ module, and that is known as the macula. Okay? For the semicircular canals, the name was different. It was crista ampullaris. Here you will call it macula. One macula is present in the utricle, and one macula is present in the secule. Okay, because there are two special areas in secule. Well, in the macula of the utricle, we talked about that. It is present on the floor. Okay. Now consider this is a secule. Okay, it's not now utricle, it's secule. Well, the macula of the secule is not present on the floor. It is present here, just like you see this screen. It is attached here like this on the wall, posterior wall, like this on the wall. So position of the macula of utricle is floor. So what is that position? Horizontal. And what is this position? Vertical. Did you see the orientation of the two? Both are maculae. Both have the similar structure. Both have the same type of hair cells. Both have the basic components which are same. But their positioning is different. One is positioned in this way, and one is hanging attached to the wall like this. Okay? The hair cells are oriented in this way, like this. All the hair cells are present like this. And here the cells are present, they are attached in this way, like this. So there is a difference in orientation, location, and that is very, very important for understanding and for the movement of the hair cells. We'll talk about that. Is the position clear? The two areas, utricle and secule, both are chambers, both are dilated sac-like structures, both have the endolymph filled inside, both have the maculae, but the maculae are different in positions. Okay? Location. Look at the structure. Here. Now, well, you have similar supporting cells and the hair cells. Can you see the hair cells? Yes. Okay. These are the supporting cells. In between the supporting cells, you can see the hair cells. From the hair cells, you can see the synapses and the nerve fibers which are going there, synapsing with that. Okay. They are not attached, they are synapsing. Remember? Just like the hearing. Okay, it seems to be attached, but they are not attached. If you closely see, oh, there is a gap. It means they are having a synapse. So it's a bottom synapse which are happening in a very special way. Anyway, these fibers are the afferent fibers going to the Scarpa's ganglion, and these are the hair cells, same hair cells just like you find in the crista ampullaris, in the same chymothelium and small and connected, and the same mechanics, everything is same, no problem in that. And they are also covered by a topping or a jelly, okay? And this jelly-like structure is called the otolith membrane, because this is now a broad piece like this, okay? So you have, just like you have a cake, okay? You have the cake, and cake has multiple layers really, a basal layer and the central layer and the topping of a jelly, something like that, okay? You have it. And then over that cake, you take some nuts, okay? Like almonds and pistachio, you crush them and you put over the top really as a topping over that cake, okay? So this cake is placed here, a big cake is here. So you have the specialized cells which are there. Over the cells you have a layer of jelly in which these hair are going, and over that jelly layer you have some particles, okay? These particles on top here, can you see the particles here on top? They're not very shown very clearly, but these are small sand-like particles. These particles are the calcium carbonate particles, okay? Chalk. You have seen the chalk which we write on the blackboard, okay? Have you seen the chalk? Yes. The writing chalk, okay? The white chalk we use. So just like that, it is made of, it's chalk basically. So you break that chalk into very fine particles, small pieces, granules like that, and you put it over that. And these are small stones or small sand-like particles. These are called the otolith. Otolith. Oto means present in the ear. Lith means sand. So the top layer is otolith. L-I-T-H. Lith. Look at the words. Oto. lith or otoconia. These are the terms used for these fine sand-like layers. So, this is the organ which is present in the utricle, and this is the same organ which is present and attached vertically in the saccule. Is that alright so far? Alright? So, these otoliths which are present over the jelly-like membrane, otolith membrane, well, these otoliths, they have weight because these are particles. And these otoliths, when we are changing the head positions and turning and moving like this, these otoliths also move here and there because these are rolling particles. They go in one side. If you are going in this way, otolith, the wazn of the otolith is there, so they will move here. If you are going in that way, the otoliths are going in the back side. If you are going in this way, otoliths are going on that side like this. It means they can move. They are not fixed. They are moving, and their weight actually is causing the mechanics. Okay, the movement is causing the mechanics. Is it clear so far? Okay. All right. So I think discussed all 5 organs, 3 cristae ampullaris and 2 maculae. 1 macula present in the utricle and 1 macula present in the saccule. Are we now comfortable with the terms semicircular canals, ampulla, crista ampullaris, cupula, macula, utricle, saccule, otolith membrane, the jelly-like membrane, and the fine otoliths or the otoconia, which are the dust particles or the calcium carbonate particles. Okay, these terms, yes.
When did it come across otolith when we were talking about the ampulla?
No. That is the difference. Very good point. Did we talk about the otolith or this sand particles in the crista ampullaris? Over the crista in the cupula? No, because cupula is attached from top to bottom and the movement is by the pushing and pulling effect of the endolymph. When the endolymph is moving, this jelly will move wavy fashion automatically. You don't need here. Here in these organs, you are here in this way and you are there. So these will move in special body positions. Okay, when the body, I'll give you the body positions when these are working, these otoliths are working or the maculae are working. We'll talk about that. Right now we are developing an anatomical orientation that we know the structures first of all. Alright? Are we comfortable with the structures first of all? Because I'll not move until we are sure about our orientation for these structures. Is that alright? All of you at the back? Sure? Okay. Now, look at the canals. Semicircular canals. I'll first talk about the semicircular canal position. Now, how are semicircular canals placed? Now look at, we are moving a step forward about the orientation of the canals. Okay? There are 3 canals, you know. One here and other here. Same identical mirror images. Cochlea and the canals and the utricle saccule. The canals here are very special and they have special names according to their positions. One canal is located in the horizontal manner like this. Look at my hands. A pipe is going in this way. Okay, like this. A pipe is turning in this fashion. What is the position of my hand? Which is it, vertical, horizontal, or sagittal, or chordal? What do you call it? Horizontal. I am moving horizontal, isn't it? I am showing you the canal is placed like this. So it's horizontal. So one horizontal canal present here, right? And just opposite to that, it's left. Now, this is your horizontal axis, isn't it? Look at the canal. Look at my hand. This is the horizontal axis, and this is the canal. Canal is not exactly on the horizontal axis. Look at that. Is it downwards or upwards? A little. It is horizontal position, but not exactly horizontal. It is like this, slightly, making taqriban 30-degree angle. 30-degree angle with this plane. Okay, so it's angulated in this fashion, but we still call it horizontal because of the main position. It is still, but making an angle, slight angle with that. Not 100% horizontal. It is making an angle. Is that clear? It is not. The second sets of canals, I am giving you the sets of canal. This canal, now look at this straight, your sagittal axis or the sagittal plane here. Okay, you are looking at that one. And one canal is placed in this fashion. Look at the shape canal. Okay, it's going like this. Look at my hand here, and one on the opposite side is going here in this way. It is not going in this way. It is not on the axis exactly. It is going in this way, like this. Okay. So what will you call this? This is the front side. Okay. And look at the level of my hand also. It is going like this. So superior. And also it is going. So it's anterior or superior. Sometimes you will read the name superior canal. Okay. Sometimes you will see it as anterior canal. Okay. Anterior superior position like this. Okay. One is here and one is here. Semicircular canal like this. Okay. So the third is, look at my hand here. It's going at this side. In this way. So you will call it posterior basically. Okay. So one is in this fashion. Now look at my hands. I am giving you the positions. One is in this fashion. Okay. This is anterior superior of the right side and this is anterior superior of the left side. Look at the position. Now look at the position of my hands here. This one here. This is posterior of right side and this is posterior of left side. Alright. And this is of right side and this is horizontal of the left side. So one is in this fashion. You can make a pair like this, right and left pair. One is here and one is here. Look at the line. They are in line. Anterior superior is going here and posterior. They are making one line or one pair, complementary. So the right superior is making left posterior, isn't it? This is the left superior like this. It is making a pair. So one line is like this. One plane is like this. They are complementary. One line is like this and one line is going in this fashion. Okay, so this is how we make the pairs. Consider these pairs in your mind. So these are the two anterior superior canals. Here you will have posterior and here you will have horizontal, तकरीबन 90 degree to each other. Well, this orientation is very important first of all. Okay, now you look at this one. Look at this one. You are looking from the superior view, okay? You are looking from here, the cut section of the skull, and you are looking from above. You want to see the area, are they making the lines or not? Are they making the pairs or not? Let's look. Shuf. This one, okay? This is anterior superior? This one? Yes. Here. And this one? Posterior. Okay. Look, direction of this and direction of this. They are making one pair. They are aligned in one direction, isn't it? Okay. Now, look at this one. What is that? Yeah, anterior superior. Right? Of the left side. Okay. And what is this one? Right, posterior. They are aligned taqriban in one direction. Okay. Alright. And look at this one from above. In this way and in this way. So they are making the pairs. So now we have the orientation about the canals. How are the canals arranged really? Filled with the fluid, having the cristae ampullaris, the sense organ, everything. This is the static position of the head. And now we'll do the movements. Now look at this again, a diagrammatic position. Okay. First of all, I'll give you an idea. The functions, I'm just giving you some functions of the utricle and saccule and the semicircular canals, and then we'll elaborate those functions. We'll talk more about that. First of all, the semicircular canals, they are concerned with the dynamic equilibrium. I'm using a word, dynamic equilibrium. When the body or the body parts are moving, when I'm moving and you're talking to you here and there and bending and doing the job, when I'm in motion and my equilibrium is maintained, then a major role is played by the semicircular canals, because this equilibrium is dynamic equilibrium. I'm not saying that it is only the semicircular canals, but a very important role is played by the semicircular canal in dynamic equilibrium. Okay? When the head is moving, when the body is moving in different direction and turning also. So especially when you are turning or rotating or you are in the dynamic equilibrium, then the word which comes in mind is semicircular canal. They are doing something. What? We'll see. Okay? When you are having the static equilibrium, for example, this is my static equilibrium. I'm standstill, isn't it? This is also my static equilibrium here now. Okay, my head position is changed, but still I'm not moving anymore. Okay? Alright. This is my position. Okay? We are offering salah. This is my position. Okay? The position of ruku. When we are in ruku, for the time being we are in static position, isn't it? Alright? When I am doing this is my dynamic position. But when I stop, after stopping, what is my position? Static. Now I am in a new orientation. My head, my body, my other parts are in a different position now. But now I am on hold. I am not moving anymore, isn't it? Then I change my position again, and then I am moving again, and then I become static again. So when I am static, then the major role is played by the utricle and saccule. When I am having the rotations or the movements of the body, then semicircular canals, but there is a role of the utricle and saccule also. I'm not saying that. It's not absolute, but the main roles which are there. Okay? So for the word dynamic equilibrium, which word comes in mind? And for the static equilibrium? Alright. Okay? For the rotational movements, when I say, which word will come in mind? Semicircular canals. Okay, now I'll give you one more function and let us see what I'm talking about. Acceleration. Okay? Acceleration is when you start moving, and acceleration is the rate of change of velocity. Velocity is moving in one direction, okay, with a constant speed. You don't change it. Okay? So acceleration is when you are changing the velocity. There is a difference really. I'm sure you know in physics. There is a difference between acceleration and velocity. Well, these organs detect acceleration. They don't detect velocity. Because if anything is moving at a constant speed, even if you are moving at a constant speed, then your organs cannot identify that. But when you are changing your speed in the initial part of your movement or in the final part of your movement, then when I start like this, as I start, I have acceleration. But after acceleration, if I maintain my rate and go on, then that is velocity. And if the velocity is constant, then my organs will not do anything, okay? They will not detect. But then again, when I slow down and I want to stop, then again it is deceleration, I am slowing down. It is the other negative side of the acceleration. In that area, acceleration and deceleration, these organs are very sensitive, okay? I'm talking about semicircular canals and utricle and saccule, all. Okay? Acceleration and deceleration, not the velocity. Not the velocity, please. Okay? When you start driving, you start the car, first gear, and you are increasing the speed. Do you feel the increase in the speed? Okay? Right? You do? Alright. Now you are on the highway and you put the car in your cruise. And once you put the car in your cruise, now, many of us, what do? They keep their leg over the steering and they drive like this. Here it's a culture really, okay? Putting your foot over the dashboard, and I saw the foot is coming out of the car really. I was so surprised what could be the position of the body. Then I realized, oh my god, it's a cruise control going on. So, because you're not doing anything, okay? The car is doing, okay? And it is a constant velocity which is going on, isn't it? Okay? And at that time, do you really feel that motion, that your motion is changing? No, you don't really. Your sense organs are not really sensing at that time. But as you accelerate, increase the speed, you feel the speed. As you slow down, apply the brake and changing it, you definitely feel. You have a sense that you are decreasing, you are increasing. But in the middle part, you don't really, isn't it? So that is velocity. And when you are decreasing and increasing, that is acceleration. Right? So the point is acceleration and deceleration. Are we clear about that? Okay. Now, be careful, Shabab. If I am going in this way, straight line, khat. This is called linear acceleration, isn't it? Okay? It's the linear movement. Utricles and saccule, they are concerned with linear acceleration. Okay? Utricle and saccule, what do? They give you an idea about the linear acceleration, they sense the linear acceleration. Okay? And about the rotational acceleration. Now I'm talking about the rotational acceleration. For example, I'm turning like this, spinning, okay? Or I turn on this side and then I turn on this side and start moving. I'm turning. The Zawiya is changing, okay, from this plane, isn't it? Degrees are changing. Now this is rotational acceleration. Or I'm going like this and I turn like this, okay? When I'm turning from straight, when I was going straight, which organ was working? Utricle or saccule, we'll talk about that. But when I make a turn really, again at that turn, my semicircular canals were happening. Then I'm moving again straight, it's utricle again. Then if I'm making a turn, so wherever your body is turning in special ways, all rotational accelerations, it is done by the semicircular canals. Did you get the basic difference of the term? First we talked about the static equilibrium and the dynamic equilibrium. Then I'm talking about the linear acceleration and the rotational acceleration. So, if you are to choose two words for the semicircular canals, which two words will you choose? Number one, rotational acceleration and dynamic equilibrium. Now you have to choose the words for these utricle and saccule, linear acceleration and static equilibrium. Make this broad concept in your mind first of all, and now we'll go into further details. Is that clear? You got the meaning of dynamic equilibrium? When you are maintaining equilibrium in motion, then most of the job is done by the semicircular. Not 100%, most of the job is done by the semicircular canals. Okay? When you are in the static equilibrium, static position, main job is done by the utricle and saccule. Okay? When you are moving straight, then it is alright. Okay? Maculae are working. When you are rotating your body, changing the angles of the body in different direction, okay, or changing the position of the head, your body is constant, I am turning my head in different directions. Now, what is going on? Is it, what do you think? It's semicircular canals mainly, isn't it? Okay? You got the basic idea? Alright, now I'll give you idea. First of all, look at the plane. Can you identify those canals, the position of the canals which is made in the form of circles? We just described it, isn't it? Can you see that? If you are looking from the front, then this purple color is giving you what? The purple color. These two. I'll identify with this one, okay? And you tell me first, okay? About this one. These two. Anterior in position, isn't it? You have seen from the front. Alright. What about this pink color? Horizontal. And what about those? Now you look at the position. Right anterior and left posterior. Are they aligned? Okay. Right anterior and left posterior. Are they aligned? And right and left horizontal. They are making the pairs aligned. Roughly aligned really, isn't it? Okay. Working pairs, I am saying that. How do they work? We'll talk about that. So we have now made orientation in our mind. Now look at these positions. Now it's a very interesting explanation and few terms which are there. Okay. Look at this picture and look at the three axes which are passing through. You have done it in anatomy basically. You know the planes which we are talking about here. Okay, one axis is called the anterior-posterior axis, x-axis. Do you see that? This is going here, from here, the nose. This axis, from anterior to posterior. This is the axis. Alright? On that axis, if you just roll that axis like this, a rod is passing like this, and you turn this rod in this way or in this way, what will be my movement?